So I started working at the university in January 2023, and one of the modules I was allocated is a module called Therapeutic Nursing, TN. So TN aims to develop mental health student nurses' knowledge of common mental health conditions and introduce them to the different psychological and social interventions that can be used to facilitate recovery. In May 2023, I had the opportunity to attend a workshop about the Tree of Life methodology, an approach that I'd never heard of before. I was drawn to Tree of Life and making it part of TN because it's a trauma-informed approach, originally developed in Zimbabwe as an intervention for children affected by HIV and AIDS. Tree of Life focuses on stories, something that we can all connect to, but it doesn't privilege the problem story. It focuses on other aspects of story in terms of our strengths, hopes, and our dreams. So in the approach, the person draws their own tree of life, and this was interesting to me as it gave an alternative to someone expressing themselves verbally. So I facilitated a session for the TN students where I gave some theory about the approach, but the main point of the session was for the students to draw their own tree of life, where the tree represented different aspects of their story. So the roots were related to their family heritage and where they were born. The ground focused on where they lived and their environment. The trunk of the tree focused on their skills and the ability that they had. The branches focused on their hopes and their dreams. The leaves of the tree looked at who were the significant people in their life. And the fruits of the tree represented the gifts that they had and the gifts that they'd received in their life as well. So once the students have drawn the tree, they then talk through the different aspects of their tree to another student. So for the session, the students brought in their pencil crayons and their felt tips, and they really embraced and engaged with the approach. In fact, we ran out of time. But when I asked the students if they thought it should stay in the module, there was a resounding yes. So that's my story about how I use the Tree of Life with mental health nursing students.